All right, everyone, we'll get started. Thank you for joining us again today. This is our second weekly news briefing. I'm not going to take up too much time because you know what this is, so I'm just going to jump right into the speakers. I know Julie Pride has some updates for us, so we'll go to Julie.
Hi, good afternoon. Currently, we have 100 cases in Champaign County. We have had 5 lives lost. 79 people have recovered from COVID. We have currently have 6 people hospitalized, and there have been a total of 2,208 people tested. And you can see after hearing the governor speak today, when you saw U of I researchers and modelers, Sergey and Nigel, talk about how many more deaths we would have had without the quick and decisive action of the stay home orders. So I just want to thank everyone for doing this. I know it's very hard. I understand that. And but you can see that we're talking about lives here. So thank you, and let's keep doing it.
Okay, thank you, Julie. Next, we'll go to Awais Vaid, who is the Deputy Administrator for the Champaign-Urbana Public Health District and an epidemiologist. So Awais.
Yes, thank you, Patrick. Good afternoon, everyone. I just wanted to take a few minutes just to talk about how testing capabilities have ramped up in our community in the last 6 to 8 weeks. If people remember, when we started this whole pandemic, testing was very restrictive and only available for individuals who were traveling from abroad, from China specifically and other countries, and the test had to be done at the CDC in Atlanta. And then following that, state had some capabilities, and we started sending samples to the state lab in Chicago or in Springfield. In the month of February and March, we just did a handful of testing throughout Champaign County. But then thanks to the partnership and leadership of Carl, in partnership with the University of Illinois, we got local testing available in our community around mid of March. And since then, we have not had a need to send any local samples to the state lab because we have established capacity in our community with a very quick turnaround time. So right now, in the last month and a half, as Julie said, we currently have tested almost 2,200 individuals in the last 6 to 8 weeks, with capacity of testing a lot more than what we are testing currently. So that was, again, thanks to Carl and the University of Illinois. And what we have done currently is anyone that has any symptoms of COVID-19, and that could be fever, cough, shortness of breath, loss of taste or smell, unusual fatigue. Any of these symptoms, even if it is not severe, they should be contacting their healthcare provider. If they do not have a healthcare provider, they can call the Champaign-Urbana Public Health District's hotline, and we can get them into testing at one of the Carl's drive-through testing facilities in town. And the results are delivered back within 24 hours. So we have increased capacity for testing. Anyone that needs testing today can get tested today as well.
All right, thank you, Awais. So our next speaker with some opening remarks is Dr. Robert Healy, who is I want to make sure I have this right, the Chief Quality Officer for Carl.
That's right, thank you. My name is Bob Healy. I'm a physician at Carl, Chief Quality Officer. And Awais, thanks for the kind words. It's always great to work with Awais and Julie from Public Health, as well as our other partners in the community, such as the university and the other healthcare system, OSF. We are excited that we're able to provide more testing now and have a quicker turnaround than we were having in the past. As Awais said, we are recommending that anyone with symptoms get tested, and you can call Carl, you can call your physician's office. We'll assess you whether your symptoms are consistent with that of COVID-19. And we will have you come in through, most often through our drive-through on South Mattis Avenue to get tested. And we also are excited that we'll soon have the availability of doing antibody testing or serology testing. And that's probably, I'd say, a week or two away from having that completed.
Okay, thank you, Dr. Healy. And then next, Sheriff Dustin Harmon is our EOC manager. He's going to talk about what the EOC is up to.
Thanks, Pat. So, you know, a question that I get quite a bit, and one that the governor kind of touched on a little bit ago too, was what are we doing when we reopen? How are we going to go about that process? I know I am very anxious to get back to some sense of normalcy as well. Well, the Emergency Operations Center, that is on the top of our minds too, because we know that eventually we will get back to some sense of regular behavior, regular activity. But I think it's also important to note that we are in this for the long haul. Reopening is a slow process. It's not as simple as turning on a light, for an example. If we don't do it appropriately, the risk that we're going to be in this exact same situation in the near future is very high, and I don't think anybody wants that. We're working closely with Champaign County businesses, healthcare organizations, and local government officials to evaluate the needs and coordinate resources in order to help us progress through this and get back to that sense of normalcy as soon as we can. We realize that normal is probably going to be a little bit different than pre-COVID-19, but still some kind of routine that we're all looking forward to again. One of the ways that we're working in the community, working towards this reopening is, you likely heard about a mask drive we're having next Tuesday, April 28th, in the back parking lot of WCIA. More information about that to come, and I know there's also a lot of information out there already about that, but we're really hyping that as a, especially with the governor's order today, after the 1st of May to, if you're out in public, wear a mask. It's now more essential than ever. So we're kind of working through some of those things and how we can benefit the community and help them and businesses to actually meet the demands of that executive order. Other things we're doing, our planning and logistics section are working hard to ensure that we have adequate supplies and capacity in the event that we do see a significant increase in cases. We're not looking at this from just a days ahead perspective, but rather a months ahead planning process, realizing that this may, at different levels, this may span out for quite a while for us. We're in good shape here in Champaign County. We also understand the situation can change very rapidly. We've seen that. We've seen daily changes. We've seen weekly changes. We continue to monitor the situation closely and follow state and federal guidelines. And I guess I'll close with, we're really prepared for a number of scenarios. That's the point of the Emergency Operations Center. We work with public health. We work with businesses. We work with our local government to plan for the worst case scenario, hoping that we're never going to see it. We're ready if it does. But we have planned out a variety of scenarios. And so we are ready to work for the residents of Champaign County and get through all this together.
Thank you, Sheriff Harmon. So obviously we wanted to get your questions answered too. So the way we did this last time, and I think it worked all right, was I'll just go down my list of participants in the meeting. And you'll have an opportunity to ask your questions. Again, if you don't have a question, that's fine. I think some of the participants here are from our partner organizations. So if I call your name and you don't have a question, just let us know and we'll move on. So Christine Herman, you're first on my list. And then also if you could try your best to direct your question to a specific person. I think that helps out too.
Julie, just to clarify, what day did the loosening of the criteria for COVID testing take effect? Was that as of today, or was that earlier this week?
It's been earlier this week. Carl and OSF and Christy have been doing testing under the new guidelines, but we just added to call Champaign-Urbana Public Health District for the hotline. So that's a new piece of it.
Dr. Healy, I wanted to ask you about the antibody testing that you mentioned would be available hopefully in the next week or two. I mean, there have been reports of high false positive rates. I'm wondering, how will you ensure that the antibody testing is reliable?
That's a great question, Christine. And you're right, there have been some reports about the different systems out there. A lot of the high false positivity has been in the kits that are for home use or rapid turnover. We're using an established, we use Abbott, that's the company we've used and bought the equipment to run those tests. It's, the reason it'll be a week or two is because we're doing validating testing on that right now. So we're using samples of blood from people that had their blood drawn before January, before even December, because we know that the virus wasn't around that. So we'll know they're definitely negative. Then we have a lot of people, as Julie said, there's been 100 in this county alone of people who have had a positive test. And once they're past their recovery phase, they're recuperating, we could test them and see if their antibody is positive. So we have a good way of validating our own test.
How will you be advising patients in terms of what the results mean if they test positive for antibody results? Does that mean they're safe to go about life as usual? What will that involve?
That's a great question, and I wish I could have a definitive answer for you, but the science isn't there yet. What we'll be able to tell is if someone has a positive IgG, that we could say you've been infected with the SARS-CoV-2 virus, which causes COVID-19, and your body's formed an immune reaction to it. What we hope to be able to say is that that you are now immune or less likely to get the disease for a long time, but we don't have an answer for that now. So right now, unfortunately, all we can say is if you have the antibody, you've been exposed to this virus and your body's formed a reaction to it. We'll just have to wait and see what the studies that are ongoing as we speak throughout the world tell us.
And then who will have access to that testing? Do they have to get it through a referral through their provider?
Just like with the PCR testing, the nasal swab testing, it tells if you have the virus in your nasal pharyngeal area right now. Same thing. We'll have our providers will be able to order this. So you'll call your provider and in consultation with your provider, decide whether this is a test for you or not.
Sorry for so many, but this will not just be limited to people who have had COVID symptoms, like people can request it even if they haven't been sick?
Another great question, and that really will depend on how many tests we could do per day. We think we have a high capacity and we'll be able to do people that may not have had symptoms. I think we'd focus it on people that have symptoms or have had symptoms recently to test them. We would like to be able to, in the future, expand that so we can do some kind of testing, or the kind of testing you're hearing about in New York City and in California, where we would do more of our population and see how many people have been exposed, but that's down the line.
And Julie, related to that, is public health involved in this in any way in expanding this antibody testing to like a broader population throughout Champaign County?
Yeah, we'll be working with Carl on this and seeing how the initial tests go once they're validated and everything, and then we will probably work to once they've gotten the initial people tested, we'll probably work on some sort of a testing strategy for our entire community and how we would roll that out.
I have more, but I'll let other people go and maybe circle back to me if you can.
Okay. Deb Pressey, you're next.
She might be on mute.
And Deb, if you were asking something, I think you're on mute, so we can come back to you if you had a question. Drew Bargman is next on my list.
No questions.
Okay. Ethan Simmons is next on my list.
Hi, this is somewhat similar to what Christine was asking, but could Robert Healy, could you just clarify again who would be encouraged to come in for those serology tests early on?
Yeah, I think the important thing would be to, if someone has a question about the test, to call their primary care doctor, discuss their unique situation, and then we can help determine if they need a test or not. Excuse me, I have a dry spot.
Okay, thank you. That's it.
Okay, thanks, Ethan. Korbin Figg, if you have a question.
No questions. Thank you.
Okay, thank you. Paul Cicchini.
My question was answered earlier. Thank you.
Okay, thanks, Paul. And Taylor Deckert.
Hi, yes, my question is for Julie. So in a press release from the health department sent back in February, you were sharing details about a measles case in Champaign County. In this release, you listed locations, dates, times of possible exposure. I'm just curious, why are we not getting this type of information about COVID-19 cases with each announcement of a new case?
Okay, that's a good question. Measles is the most contagious disease known. And so it actually lingers in the air for 2 hours after a person leaves an area. So even though most people are vaccinated against it, we can't contact trace every place someone's been. With COVID, it is different. We need to have, it's not something that's caught like just by walking by somebody, for example, like you could if it were measles. So what we do when we get a case, so we get a positive case, we immediately contact, so this is an immediate contact thing. So the labs or the hospitals will contact us within 3 hours. We get the result and we do a case investigation. We call the individual and we start working back and we go to 48 hours prior to the onset of symptoms. This is called contact tracing. And then we move them forward through that entire period where they were infectious and try to locate everyone that they would have had a close contact with. In this case, a close contact is considered someone who is 6 feet away. Until recently, it's been 6 feet for 10 minutes. So basically what that means is it's not somebody you just happen to walk by or you happen to, cross paths with. So this is somebody that you've actually had some close contact with for a little bit of time. So that's why we don't do that. With measles is one of the diseases where you have to do that. There are other diseases like hepatitis A, which is a foodborne or waterborne type illness, but we could do that. We would have to do that if it were associated with a restaurant, for example. We would never be able to know who all ate in that restaurant. So that's when we have to go to the media with that type of thing. So each illness has its own algorithm of what we do for each case. So case investigation is different for every single disease.
And then a follow-up. So there's been a couple of cases where it's like, oh, we found a case at this retailer or an employee at this business. Then there's some cases where it's like, oh, it's just like a 30-year-old female. Is there a reason why details are different for each case?
We don't report where the person was. So a lot of times people report that themselves, or somebody will say, we have a worker here. There was a place in town that shut down because they thought they had somebody there. That's not the health department doing that. So that's why.
Alrighty. And then for the contact tracing, how many people do you have working on this task, and what kind of goes into that?
Okay, we have, so in a normal time, we have 2 people working on communicable disease investigation, 1 full-time and 1 backup. And then we have 1 specific for STDs, which is its own thing. And then we have 1, we have the entire environmental health team. So everybody comes together based on whatever kind of disease it is. In this case, what we have is we have case investigators, and we have right now 4, and then we have people who are doing the contact tracing with that as well, and that's a 10 or more right now. And we also have, we're able to keep expanding that out. Our agency has 120 staff right now. We can expand that out greatly with our own staff. And then, of course, if we needed it, we could bring in others from the community and do just-in-time training. But we have looked at all types of scenarios, and we appear to have enough contact tracers within our organization to handle a county of this size. So we should be good.
Thank you.
You're welcome.
Okay, thanks. I'll circle back to Christine if you have another question or two.
Oh yeah, Julie, you said until recently it was within 6 feet of someone for 10 minutes. Has that changed?
I think that now the guidance now just says within 6 feet of someone. So it's not necessarily 10 minutes. We don't necessarily say 10 minutes, but what we're trying to do is just assess, was this somebody that you think you walked by in the grocery store and you knew and you said hi and kept going? Or is this somebody that you were in a car with? Or, so it's an assessment done every time. So, and nobody usually knows, oh, hey, I know I was talking to my friend for 10 minutes and we were within 6 feet of each other. So,
Yeah.
That's just kind of a guidance. So the investigators help work people through the different scenarios, and they will bring up different things to help them think about, if they say they were somewhere, well, how'd you get there? Were you in the car? Well, was someone in the car with you? Were you wearing masks? And we do that with their employment and all kinds of stuff.
Okay.
So,
and then with contact tracing, oh, sorry, go ahead.
Oh, I was just going to say, ideally, everyone in our community, if you get a call from public health, and we ask you to start doing contact tracing, ideally, you're not going to have anyone in your contact tracing list, because you should be, staying home, wearing a mask when you're out, and with the exception of people in your household.
Yeah, and with contact tracing, then you're following with the individuals who did have less than 6 feet contact with people who have a confirmed case. Are they following up with these people like every day to monitor symptoms twice a day? Is that right?
Yes. So, well, what happens is, so everyone that we get in the contact tracing, then we follow up with them. The person who is ill is placed into isolation, and then the people who are close contacts are placed into quarantine, and then we'll get them tested if they have any symptoms at all, and then that's how it works. And then you just go from there with each case. But yes, we follow up with everyone every day.
Regarding a follow-up on Taylor's question about information shared on cases, if last week you said there were no cases confirmed in nursing homes, jails, or congregate facilities, if there ever are confirmed cases in those areas, will we be notified in those daily updates that they were?
I think I have to look exactly what we would do, but typically, an outbreak is considered 2 or more people in a setting. Is that right, always? I'm pretty sure that's it. So yeah, so if we had 2 or more in a setting like that, a congregate living setting, that would be considered an outbreak. So we would, yes, I think that information would be out there.
And then regarding cloth masks and the May 1st requirement for wearing them in public, if people do not have a cloth mask, if they don't sew, what is your recommendation for what they should do? A scarf, a bandana around their face? I've tried that and it falls down and I have to keep fidgeting with it. What is your recommendation?
Yeah, there are some no-sew masks on there. People who can too, if they happen to have the money, you can still order these online, these cloth masks. You can order them online. And that would allow us then to save the other masks for people who can't. We are going to encourage places like grocery stores and businesses to purchase these for their employees. So, we're going to encourage those who can. I mean, at Public Health, we're looking into purchasing them for all of our staff, for example. So, businesses that have essential workers should look into this. This is not going to be something that we're going to be doing for, a week or a month. This is going to be the new normal until we have herd immunity and we have a vaccine.
And I know there will be some places that are allowed to reopen on May 1st as essential businesses. And I'm just curious, we got a question from a listener who wanted to know places that are reopening, will they be required to do any type of cleaning, sanitizing in case there had been exposure to the virus there in order to reopen? Is there any requirement for that or guidance for that?
I will have to look if there's any guidance, but essentially if a place has been closed down for a month, you're going to want to clean anyway, but not necessarily for this, because it's not like the virus would just be hanging out there, alive forever, being able to be transmitted. So what the requirements will be social distancing and wearing masks for everyone. So that's what needs to get figured out. So places need to think about that. But as far as moving forward, businesses need to do the same things that we had talked about before: sanitizing commonly touched surfaces, providing PPE for employees, making sure that there's social distancing, those type of things. And if people are coming into a business, they need to be doing the same thing.
And then I've got one more for Dr. Healy. I just saw in a news story that from WBZ that quoted the Illinois Hospital Association saying hospitals across the state have been running into issues being able to discharge residents of nursing homes, patients with COVID-19 when they no longer need hospitalization, they might still be symptomatic. Are you running into that at Carle, and how are you handling that, if so?
Yeah, good question. In the beginning, we actually were running into some of that in the beginning of this pandemic, where the nursing home would require a certain amount of testing or a certain amount of proof that the patient didn't have COVID-19. And luckily, the state and county public health put out statements informing them they didn't have to do that, that they should just, any new admission they got would be considered possibly infected, and they would keep them isolated or quarantined until a certain amount of time had passed. So even though we had some problems with that early on, that problem went away. We do still have some sporadic problems where it'll pop up where a state facility doesn't want to take somebody until they're negative if they've had a positive test. And that could be a little tricky because, like you said, people could be in the hospital when they're ready to go somewhere else. But so far it's been manageable.
And Julie, have you been involved in terms of nursing homes that are concerned about taking home patients who've been hospitalized, whether it's for COVID-19 or otherwise, and concerns over possibly spreading that to other residents or through staff contact with them? And, you know, obviously with nursing home outbreaks, that's like a scary thing. And I'm just curious if you have any comments on that.
Well, we are, you know, the congregate living facilities in our community have been amazing. I said this last time. It is not just the long-term care facilities, but it's also, you know, the shelters. It's also the jail. They're doing everything they can to prevent this, including, you know, following all the guidance that we've provided. So, you know, the main thing is that people in a congregate living facility are like a cohort. So they are not, the virus is not going to come in on any of them. The place where it's going to come in is through visitors or through employees. Every place took care of the visitors way early on. So you don't have to worry about the virus coming in on those, but you always have to worry about it coming in on employees because they're not part of the cohort, they don't live there. So what they're doing is just amazing infection control. Masking employees anytime they're anywhere around residents. The nursing homes and long-term care facilities are keeping cell phones out of the area at all. They're doing lots of cleaning and sanitizing and things like that. So your cohort is not going to spontaneously generate, you know, the COVID-19. It's going to come in on someone, and if you can prevent that as much as possible from having any mechanism to get in there, then that's how you prevent the outbreaks.
And related to that, do nursing home staff get trained in the proper use of PPE? I mean, I understand certified nursing assistants don't have the same level of training as nurses and doctors, that sort of thing.
Well, I mean, the PPE that they're using, we provided guidance, yes, and but they're not using like N95s or anything like that. What they're using are the regular surgical masks or cloth masks or something to keep from having droplets or anything come out of them if they're asymptomatic. All these places are also doing symptom checks and things like that. So in Champaign County, we have a long established relationship at Public Health with the hospitals and the long-term care facilities and the shelters through an infectious disease group where they are constantly talking about this. So we do all kinds of trainings. We talk about different guidance. We talk about problems they may have. And so the good thing is the communication was already there. The communication between all of us was already there, and that helps a lot. And also the long-term care facilities are calling us all the time, and you know, if they need anything, if they need personal protective equipment. So we're making sure that no one's running out of anything that they need to do their jobs.
Okay, I do want to just check in with
I can't
Deb
hear
Pressey.
anything. Can you all hear?
So I do want to check in with
I have
Deb
one more
Pressey.
question, but
Oh, sorry. One more time with Deb, just to make sure. I don't know if Deb was having
sorry. Okay.
technical issues or anything like that.
Oh.
Deb, if you have a question, go ahead.
Oh, sorry. My audio dropped out for a minute. Can I ask one more question?
Sure. Yeah. Let's do one more, and then we got a couple closing comments we want to make.
Sure. Okay. Julie, I was reading something from the WHO saying that the positive rate, if it's like less than 10%, that's a good benchmark for figuring out if you're doing enough testing in a certain area. And I know in Illinois, we're at around 20%, but in Champaign County, it looks like we're at like 5%. Does that suggest to you that we're doing enough testing, or do you feel like we still need to be doing a lot more testing here?
Well, we're definitely going to be doing a lot more testing. Before the restrictions were such that we just couldn't get people in. And that had to do with, scarcity of testing. And that's all over the place. But you will really start seeing a lot more testing happening here.
Okay, so thank you all very much for attending today. I just wanted to mention we're trying to get out as much as possible information about 211, which is a service provided by the United Way of Champaign County. Anyone who needs resources or help can just call 211 to be hooked up with the trained specialists, and they'll find them help that way. And then also, there's always information about local resources and the local response on the Champaign County COVID-19.org website, and also the Champaign-Urbana Public Health District website. So we're trying to point people to those two places for up-to-date information as well. Anything you guys can do to help us out with that would be greatly appreciated. That's all we have for today. I am recording this on my end, so if anyone needs a copy of this later, just shoot me an email at pwade@illinois.edu and I can get that to you. But for now, I'm going to go ahead and end the call. So thank you all very much.
Thank you.